This medication, Sps Enema, is used to lower high levels of potassium in the blood, which can cause heart rhythm problems. It works by helping the body eliminate excess potassium. It is important to follow the dosage instructions provided by your healthcare provider. The optimal timing for taking Sps Enema is typically determined by your healthcare provider and may vary based on your individual needs. Before using Sps Enema, make sure to read the product instructions and directions from your doctor or pharmacist. It's important to shake the bottle well before using it. You can warm the suspension container to body temperature, but don't heat it because it may change how well it works. Also, follow the instructions for using a cleansing enema before using this medication. Typically, you'll use sodium polystyrene sulfonate rectally as an enema every 6 hours as needed, keeping it in the rectum for several hours if possible. After each dose, use a non-sodium containing cleansing enema as directed. The dosage and length of treatment will be based on your medical condition and response to treatment, so it's important to follow your doctor's instructions carefully. And remember, do not use more of this medication or use it for longer than directed, as it may cause your potassium blood level to drop too low. Make sure to keep all lab and medical appointments so your doctor can check your potassium blood level. If you experience loss of appetite, nausea, vomiting, or constipation, it may be a side effect of Sps Enema. It is important to eat enough dietary fiber, drink plenty of water, and exercise to prevent constipation. Your doctor may also recommend a laxative. Remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. Most people who use this medication do not experience serious side effects. However, if you notice any muscle weakness or spasms, irregular heartbeat, or mental/mood changes, it's important to inform your doctor right away. This medication can also cause serious intestinal problems, such as bleeding or blockage, which require immediate medical attention. If you experience severe constipation, bloating, black or bloody stools, or paralysis, seek medical help right away. Although rare, a serious allergic reaction may occur. If you notice any signs of a severe allergic reaction, such as rash, swelling, or trouble breathing, seek medical help immediately. If you experience any side effects not listed here, contact your doctor or pharmacist. If you are allergic to sodium polystyrene sulfonate or have any other allergies, it's important to let your doctor or pharmacist know before using this medication. This product may contain inactive ingredients that can cause allergic reactions or other problems. Make sure to talk to your pharmacist for more details. It's important to note that this medication contains a large amount of salt, sodium. Do not use salt substitutes that contain potassium without asking your doctor first. If you have kidney problems, heart failure, high blood pressure, or swelling hands/ankles/feet, it's essential to follow your doctor's instructions for limiting the amount of sodium in your diet. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have stomach/intestine/bowel problems, a low level of potassium in the blood, or are planning to have surgery. It's important to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at greater risk for severe constipation when using this medication. Additionally, this medication must not be given by mouth to newborns, especially premature infants. Newborns with slow gut function must also not use this drug. Caution is advised when using this medication rectally in newborns and children, as they may be more sensitive to the side effects of this drug, especially severe constipation and intestinal problems. If you are pregnant, it's important to tell your doctor before using this medication. However, this medication is unlikely to pass into breast milk and harm a nursing infant. It's essential to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Sps Enema, as they can affect how your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use, including both prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Also, avoid using any laxatives that contain sorbitol while taking this medication, as it could increase your risk of intestinal problems. Be sure to check the side effects section for more information. If Sps Enema is swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms such as passing out or difficulty breathing, they should seek immediate medical attention. Symptoms of an overdose may include changes in mental/mood, muscle weakness, fast or irregular heartbeat, slowed breathing, and paralysis. It is important to call 911 for emergency assistance, or contact your local poison control center for guidance. For U.S. residents, the number for poison control is 1-800-222-1222. For Canadian residents, they can call a provincial poison control center. It is important not to share this medication with others. It is recommended to undergo lab and/or medical tests, such as blood levels of potassium and other minerals, as well as EKG, while using this medication. It is important to keep all medical and lab appointments. Consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at the usual time. Do not take a double dose to make up for the missed one. Make sure to store your Sps Enema in a tightly closed container at room temperature, away from light and moisture. It's important not to freeze it or store it in the bathroom. And remember to keep all medications out of reach of children and pets. When it comes to disposing of your Sps Enema, do not flush it down the toilet or pour it into a drain unless directed to do so. Instead, make sure to properly discard the product when it is expired or you no longer need it. If you're not sure how to do this, be sure to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.